about Parkinson and about its symptoms. Everyone have heard about the treatment for this type of disease. So Parkinson has another common name is shaking palsy. It includes like shaking and palsy. So like the normal people, they will shake like this, right? But Parkinson patients, their hands also becomes stiff. And does anyone here remember about the four hormones that I mentioned? Like the other day? Serotonins, dopamines, oxytocin, those happy hormones. And there is one important hormone which is dopamines. It work like our accelerators, like you have to slam it so that your car can move forwards, right? So dopamines work as a catalyst in our system to and to make your body work. If people don't have that kind of hormones, then you are contracted to Parkinson. So if you don't have, like if you want to move your hand or your legs, it's because the presence of dopamine. So it helps the muscle to move. In your case, I actually don't see your father's medical report, but Parkinson can be one of the most complicated and intractable disease that you can think of. And and also I have some patients who have this type of disease, and they have like specialists, as they call neurologists. So you can see they have all kind of medicine that help to repress all the symptoms. I don't know if you have met your father's neurologist or not, but I advise you to see one, and otherwise you can see the home doctors, and then they can refer you to the neurologist. And well, I remember when I wrote my university thesis. When I graduate, my topic was about Parkinson's, and when I was in college, I was very fascinated by treatments of Parkinson's. If anyone have read my book, then I was really into in brain surgeons, and I'm now I only work surgeries with skins, but I'm still have a very big passion for brain surgeries. One of the reasons is because my dad also got Parkinson's, and another reason is, because of my passions. Yeah, so the treatment of Parkinson's become more and more advanced, and there is one of them called deep brain stimulations. You can ask more from the older neurologists. Those the methods basically is you are going to insert metal wire into your brains, through into some kind of middle lobe, so that you can use the electricity transfer from the wire to stimulate the lobe to produce dopamines. And most of the cases, many Parkinson patients respond well to this kind of treatment. So they also the medications for Parkinson is are very advanced now. So to answer your question, I think that you should go to see especially the neurologists, so they can have a way better approach for your situations. Thank you for your questions. So doctor, I have a question like, what causes Parkinson's, and at what age are people most likely to get Parkinson's? So Parkinson's, there's many reasons behind still remain unknown, but one of the reasons is because of stroke, even mini stroke. So there in the brain there is an area called substantius nigra. It's like we have the upper part of the brain and the middle part, which is the substantius nigra and the brain stems. And if the areas is injured by any reasons, then it will stop produce that kind of hormones. So this usually because of the dead cells or some kind of other reasons, but it will cause the disease. And there are many way to many way many way to diagnose this kind of disease. First up is the shaking hands. So the other thing is about your handwriting. If you quote your relatives, your family members to write their name, ask them to write their name, and you cannot read the letters, read the words. Well, wait. I know that my handwriting is not so good as well, but I'm a doctor, right? So that doesn't mean that I have Parkinson's. So this again, it's about you cannot read that person's writings. That is one of the most important indicators. So if you don't want to get contracted with Parkinson's, then you better pay attention to your handwriting. Yeah, and another factor is that they have a very steep hands. It's not flexible like you guys, you know. And the reason why it causes this kind of disease, I don't know for sure. As I mentioned before, many reasons remains unknown, and also many other disease. Well, also I think that we don't know for sure the reason behind it, and sometimes like you put your hands on your forehead, when you go to sleep, try to think about the reason behind it, and it's way too tiring.